على إتاحة الفرصة لي إن أنا أشارككم النهاردة في اليوم الجميل ده. أنا إن شاء الله مش هطول عليكم، هتكلم عن ال Drug Intoxication وال Pediatric Psychiatric Emergency. أنا دكتور سارة شاهين, Associate Professor of Clinical Pharmacy, Faculty of Pharmacy, Ain Shams University. Our agenda today will contain a brief introduction containing some definitions. Then we go through some examples of drugs which are shown to be associated with the psychotic symptoms with the published case reports. Then we will go briefly through how to manage the symptoms of intoxication in the pediatric emergency. And then we will summarize our talk and state some recommendations. Many non-psychiatric medications can cause non-psychiatric neuropsychiatric effects, which range from anxiety to psychosis. Drug-induced psychosis was first diagnosed in the 19th century. Since then, many medications have been associated with these phenomena. Healthcare professionals must be familiar with the neuropsychiatric adverse effects of many common prescription and non-prescription medication, so they can educate patients and caregivers about these potential adverse effects and develop strategies to minimize these risks. Medication-induced psychosis is usually related to either increase in the dosage or change in medication regimens, or it can also occur due to drug interactions associated with the concomitant administration with psychomimetic drugs. These symptoms or the psychotic symptoms can appear within hours or even days of drug initiation or dose change or withdrawal or discontinuation of some drugs. Some risk factors were found to be associated with increased risk of occurrence of medication-induced psychosis, such as the age where younger children are more predisposed to develop these side effects. Also the elderly, patients with altered hepatic or renal functions, female gender, patients using polypharmacy, and previous psychiatric history. According to the Diagnostic and Statistical Manual for Mental Health, the criteria for medication or drug-induced psychotic disorder can be applied if the following is met or are met. Symptoms not better explained by a psychotic disorder, such as schiz or bipolar disorder. Evidence from medical examination, lab, or patient history that psychotic symptoms developed during the drug or substance use or within 1 month of withdrawal from the substance. The presence of delusion or hallucination. The psychotic symptoms do not occur only during the episode of delirium. The symptoms are causing significant distress or impairment in the one's daily life and the ability to function. Now we will go through some examples of commonly used drugs in the pediatric population and were found to be associated with psychotic symptoms, such as corticosteroids, the attention deficit hyperactivity disorder drugs, Litra or the leukotriene receptor antagonist drug, antihistaminics such as the diphenhydramine and the promethazine, some antiepileptics, some antibiotics. One of the famous group Fluroquinolones, and others. We will talk through 2 examples in this category. First, the corticosteroid. As we know, children usually use the class of corticosteroid in many disorders such as asthma, autoimmune diseases, and cancer. And many of these categories have been reported to experience steroid-induced psychosis. As we can see in the case report, in a steroid-induced psychosis in a child having a nephrotic syndrome after the use of the steroid for induction therapy for the nephrotic syndrome, the child developed steroid-induced psychosis. Also, in a case series of 18 patients without prior psychiatric history, these patients also described the steroid-induced psychotic disorder, and these symptoms persisted for at least 7 days. It was found that higher doses of steroid predispose the individual to suffer from this disorder. For management of this disorder, it was recommended that tapering the steroid to the lowest dose if possible, or discontinuation. Also, the initiation of antipsychotics such as haloperidol or chlorpromazine or risperidone were found to be effective. So we can recommend in these cases that given the common use of glucocorticoid therapy in children, it's important that physicians and parents recognize the signs of steroid-induced psychosis and so be aware of the data on treating these complications. Second, we will talk about the EDH drugs, which can cause hallucination in some kids, where drugs for EDH can cause children to have hallucinations. And the FDA have analyzed data from 49 clinical studies and found that some drugs can be associated with these psychosis and mania in some patients with no previous risk factors. Some children reported hallucination that worms and bugs or even snakes were crawling on them. The analysis involved drugs containing the methylphenidate, such as Ritalin, Ditrena, or Concerta and Metadate. Also the amphetamine and dextroamphetamine, and the atomoxetine, which is found in Strathera. All these molecules have been associated with these psychiatric side effects. LITRA, or the leukotriene receptor antagonist, especially the montelukast, in a case report, a 12-year-old female child were found in the pediatric emergency department. So her chef complained hearing of voices and audible thoughts and anxiety. On inquiry, the child was found to administer the montelukast for her asthma attack. And so many other reports afterwards were confirming these findings, where leukotriene receptor antagonist was associated with increased neuropsychiatric events in children and adolescents in a self-controlled case series. So the FDA required a black box warning about the serious mental health side effects for the medication singularly containing the montelukast, which is used in the management of asthma and allergy. So the FDA advised that restricting the use of these drugs in allergic rhinitis, where the disorder or the neuropsychiatric disorder as a side effect of montelukast were more commonly frequently reported for children. Antihistaminics, the most commonly used antihistaminic were diphenhydramine and promethazine, or the more common reported side effect or psychotic side effect were reported with these two drugs, which were present in many of the OTC medication called preparation, which can be used by children. These events can even occur with therapeutic doses of diphenhydramine or promethazine, suggested that the emergency physician must be aware of these potential psychiatric side effects and keep these in the differential diagnosis when patients present with psychosis, and using the OTC preparation at the time of presentation. Management of this condition in the case reports presented resolved even after 2 days after the drug discontinuation without the use of antipsychotic medication. In some cases, the chlorpromazine was used and it was effective in most cases. Antiepileptics. In a study demonstrating the psychotic disorder induced by the antiepileptic drugs in people with epilepsy, the investigation included the patient using the antiepileptic drugs. It was found in a multivariate logistic regression that there are 4 factors associated with the antiepileptic drug-induced psychotic disorder. These factors were the female gender, the temporal lobe involvement, the use of the antiepileptic, the levetiracetam, which is used commonly in the pediatric population, and there was a negative association with carbamazepine. Antibiotics, especially the fluoroquinolone. As we know that despite the attractive profile of fluoroquinolone as an anti-infective agent, their use is limited in children due to their safety concern. Also, the American Academy of Pediatric policy statement supports strategies to limit the fluoroquinolone use in children for treatment of infection caused by multi-drug resistant organisms for which there is no safe and effective alternative and when no other oral options are available. Even when these drugs used in cases where their benefits outweigh any risk, ciprofloxacin and gatiflixacin indeed induced hallucinations and acute psychosis in the pediatric population. And these cases suggest that caution should be exercised when administering fluoroquinolones and that discontinuation or switching of treatment should exist if the patients start to exhibit these symptoms. We will talk about two other agents, the dextromethorphan and carbon monoxide. Dextromethorphan, as we know, it's an OTC cough suppressant molecule, which can be included in many cough and cold preparations. Dextromethorphan abuse leads to approximately 6,000 emergency room visits each year, with half due to abuse by those aged 12 to 25 years old. At higher doses, it can produce psychotic symptoms, including mania, panic, extreme agitation, and hallucinations. And as we can see, there are also case reports reporting these dextromethorphan-induced psychosis. About carbon monoxide poisoning, it's an interesting issue where it can cause a delayed neuropsychiatric symptom, where these psychotic disorders occur following an interval of several days or even several weeks post carbon monoxide exposure. And it can be presented in many different manifestations, ranging from behavioral and mood disorder to encephalopathy and seizures. And it also can cause a long-term neuropsychiatric symptom. These raise the awareness of the need for a close neurological follow-up for patients who underwent carbon monoxide intoxication. So how can we approach the pediatric patient with acute onset psychosis? First, we have to keep a safe environment where the patient can be observed and contained to avoid self-harm or even harming to others. Medical management is usually unnecessary if the offending agent is discontinued, where usually medication-induced psychosis is self-limiting, where it resolves within days or even within a day or even days after discontinuation of the offending drug. Short-term treatment with antipsychotics or even benzodiazepine may be needed during the period of acute psychosis in some patients who found to be in danger of harming themselves or others. What about medication retrial in case this drug is important to be used? This can be done in case that psychotic disorder were associated with high dosage or it occurred due to drug interaction, concomitant administration with psychomimetic drugs. These drugs can be initiated at lower doses with careful monitoring of the patients for early signs of psychosis. To summarize, it's important to be aware of the psychotropic adverse drug effects of many common non-prescription and prescription medications. Patients should be instructed to consult their pharmacist or other healthcare provider prior to using of any non-prescription medication, and to avoid the consumption of excessive consumption of caffeinated product when taking psychomimetic agents. Also, we have to educate patients and caregivers about the potential adverse drug effects of psychomimetic drugs, and that counseling about the adverse drug effects for each patient encounter will aid the early detection and prevention of medication-induced psychosis. Finally, for preventive strategies, these can include avoidance of high-risk medications, the appropriate dosage regimen based on age and weight, reduction of the use of polypharmacy to avoid drug interactions, with close follow-up and monitoring for the suspected drugs. Thanks for your time, and thanks for this opportunity for having sharing with you this lecture or this talk. I'm very pleased to be with you today. I hope my talk was useful, and thanks.
احنا اللي متشكرين جدا الاستاذه الدكتوره ساره. فرصه جميله جدا ان احنا نسمع حضرتك ونشوف التعاون بين الكليات المختلفه من اجل مصلحه المريض، وده هدفنا جميعا. انا بشكر كمان الدكتوره غاده شوشه لانها عرفتني على حضرتك وادتنا الفرصه ان احنا نسمعك، وهي بس كانت هتبقى معانا النهارده بس عندها ظروف، عشان كده لازم اشكرها لانها السبب في المعرفه الجميله دي، وان شاء الله تستمر ويبقى التعاون مستمر بعد كده باذن الله. شكرا جزيلا للمعلومات القيمه يا دكتوره ساره، والتعاون في المستقبل دايم باذن الله. ادعو لتقديم دكتور اسامه صلاح في التوك بتاعه، واكرر شكري ليها لفكرتها الرائعه.
يا دكتوره ايمان.
فندم معلش مش سامع مين بيتكلم.
great approach ان حضرتك to include الفارماسيست.
الحقيقه
انا منى رشاد بشكر حضرتك. it's a great approach to include pharmacists.
انا فعلا سعيده جدا. الاول لازم اشكر الاستاذه الدكتوره سحر حسين على فكره الويبينار من اصله، ثم اشكر كل من لبى دعوتي في ثواني اول ما طلبت انه كل التخصصات تكون موجوده، ثم اشكر الاستاذه اشكر الدكتوره غاده شوشه لانها رشحت لنا الدكتوره ساره شاهين. لما كنا بنسال هنجيب حد توكسيكولوجي ولا هنجيب ايه، فقالت لي انا اعرف حد متميز جدا في الكلينيكال فارماسي، فهي معرفه رائعه، وان شاء الله يبقى باذن الله التعاون مستمر بعد كده
ان شاء الله. اكيد ان شاء الله. ميرسي لحضرتك.
على فكره هايله دكتوره ايمان، وتعاون مثمر ان شاء الله. الف شكر دكتوره ساره.
باذن الله.
شكرا لحضراتكم.
الحقيقه انا فخوره جدا بكل من قدم توك النهارده. انا يعني جد فخوره بالاختيارات والابداع في تقديم الفكره لتوصيلها لينا جميعا. فادعو الاستاذه الدكتوره سحر تقدم لنا الدكتور اسامه صلاح، ثم هنختم باذن الله بالدكتوره هويده. اتفضلي يا دكتوره.
شكرا دكتوره ايمان على المجهود الجبار الحقيقه. يعني دكتور اسامه صلاح الشرقاوي، وحده الاعصاب الاطفال، هيكلمنا عن neurological impact on pediatric psychiatric emergencies. اتفضل دكتور اسامه، بس مش هنطول بقى.
حاضر يا دكتور. حاضر دكتوره ساره، بس استاذ حضرتك تديني الشير.